gestation coding belongs to this medical and surgical section. Okay. Most of the PCS codes, it's belong to the first section. And the second section, what is the second section? Second section is obstetrics. That is mothers. The people who are coming for product of consumption visit. If a mother is pregnant, okay, from the pregnancy period, her complete account, like from 8 weeks of pregnancy till delivery, you have to consider that female as an OB patient and you have to assign these PCS codes. In ICD, how you will assign OB coding? Okay, I will ask you a question. A patient is coming to the hospital with UTI. Okay, she is a pregnant patient with gestational weeks of 25. What is your pediatrics? Her gestational week, the series of your pediatrics. That is enough. I will repeat the question. A patient is coming to the hospital with a complaint of UTI. She is being treated with antibiotics. She is a pregnant patient with her gestational age is 25 weeks. What is the first alphabet of your code?
O
yes,
series.
it is O code. Very good.
O series is PDX, ma'am.
In PCS, the same pregnant patient, she is coming to the hospital for the same UTI, a Foley catheter is placed. Okay. So, from which section we will code?
Obstetrics, second section.
Z38.
Read the PPT and then give me the answer. Procedures performed on the products of consumption only. So which section? Foley catheter is placed to the mother.
0.
Okay. Which section we will code? Yes, it is medical and surgical section. Very good. So what are the coding we have? What are the conditions in which we are going to use section 2? Any procedure which is done for the baby. Okay, before the baby is born, mother will be getting an hospital admission. Okay, so any procedure which they are performing on the baby, like fetal monitoring and artificial rupture of membrane, which is done to the amniotic sac. So that is also a part of product of consumption, right? So such procedures are coded under OB. Other than that, you have to consider it under medical and surgical section. Clear? Yes. So then go for section 2, which is placement. Placement section has root operations, immobilization, packing, compression. So what is that placement? What is placement? Any external devices which is placed upon the human body. For example, if the patient, I think some experience, like previous students are also present, okay? So I will ask you a question. A patient is getting inserted with a pacemaker. Yes, it is getting inserted with a pacemaker. So can I code it under section placement? Yes or no?
Yes.
Yes.
No. No.
Yes.
No.
How a pacemaker is going to be inserted into the body? How?
By incision.
Implantation.
Excision.
How? Is it a surgery or not?
Pocket for that pacemaker.
Now tell me the answer, others in the team. Everyone, is it a surgery or not?
Surgery.
Surgery only.
Insertion of a pacemaker. Is it a surgery or not? Simple question. Why am I not getting any answers? Am I going very slow? Yes. So
Surgery.
it comes under first section. Agree?
Yes.
Medical and surgical section. So what you can code under placement?
Segment removal.
Splint placement. What is a splint? An
It is
external
device
device for
Right.
immobilization. And any
support the
compression
body.
material or any packing material which is applied over the body, which is not requiring any type of surgical intervention. No surgery is performed, but as a therapeutic treatment, as a procedure, they are going to place something over the body. So such procedures you can take it under placement. See the examples in the screen. Application of sterile dressing to wound. Change of packing. Packing material is if you get a nasal bleeding, okay? Mostly they will apply a silver nitrate material, silver nitrate into your nose. It is externally they are going to just apply silver nitrate. So that is an example, a very good example for packing. Now, everyone understood the difference why we have a separate section for placement. Any surgical procedures can be coded under placement or not? Yes or no?
No.
It will be better if I get answers from new joinees, okay? Why? Because you have to, if you give the answers, I can get a point whether you are understanding or else I can repeat. Any questions, please ask then and there. Got it, team?
Yes.
Yes. Any questions, you can just, any major questions, you can unmute yourself and you can ask. Okay? And the second section is administration section. Administration section is for any device, any substance which is or not the device, any substance. For example, any IV antibiotics, any materials. Yes. Having any doubt? Team, if you are not having any doubt, kindly mute yourself because it will disturb others in the class. Yes. So in under administration section, any new substance or blood products, anything if it is given into the patient's body. See, for example, not vaccination. Yes, the vaccination or blood transfusion, any injections. So you can give under the section administration. Got it?
Saline also considered as administration.
Yes, and one more thing. Generally, IV fluids, saline, antibiotics, these are not separately coded under inpatient coding.
Okay.
Okay. Generally, under inpatient coding, we will report separately for transfusion, blood transfusions, or any
Vaccination.
vaccination if your client requires. Not all projects don't entertain you to code a vaccination pieces separately, so that is optional. Okay, so apart from these, and vaccination and transfusion are the two categories which we separately uh, report. Okay, generally saline or any type of IV fluids or whatever is given by IV, even antibiotics, we don't have a separate code for it. Okay, it uh, we are not reporting it separately. Got it. Now, so the next section will be measurement and monitoring. Okay, so the measurement and monitoring, it is a simple, that is a simple difference. Measurement is taking one-time reading. Okay, it is just in one-time reading. And monitoring is you are going to take the reading frequently and you are going to monitor the changes. Okay, the changes are recorded. Just if you are, so if a procedure, if it is done for a single time, for measurement, if it is done for the single time, take it as measurement. Okay, but throughout, like a fetal heart rate, they are not going to check once. They are going to check maybe until delivery. From the time of admission till delivery, they will have an eye on the fetal heart rate. So at that time, you can consider it as a monitoring. When we enter root operation classes, that will be explained in detail. Okay, so when you have to take root operation as monitoring, when you have to take root operation as measurement, that we are going to explain separately. Okay, so now first know the broad classification, the first character of PCS. So how this PCS is classified, that's all. Okay, so then the sixth character will be, the sixth section will be extracorporeal. The extracorporeal or systemic assistance and performance. So that is like dialysis, hemodialysis, any ventilation given. What is extracorporeal?
It is also
Yes.
mechanical.
It outside of the body.
Yes, extracorporeal, very good. It is outside of the body. So outside of the body, if any procedure is done, just like a mechanical ventilation is what? A ventilator machine is going to do the performance of the respiratory system. Similarly, cardioversion or hemodialysis. Hemodialysis, which function? Yes, what is the function? Hemodialysis, purification process. Yes, which has to be done by the kidney, a machine is doing. So it is a separate assistance in the performance. Anything which is done, your body must do, but your body is not doing, a device is doing, which is present externally. That is extracorporeal. So such procedures you can assign under sixth section. And the first character will be 5 for it. Okay. So you have to know the difference. So sixth section, what will be the character value? What is the first character of your PCS?
Medical and surgical.
Yes, it is 5. Very good. So now, your 7th section is therapies. Same extracorporeal or systemic therapy. If it is done for assistance purpose, if it is done it as a performance, your body is not doing, so an external machine is doing, take it under section 6, that is assistance and performance. Similarly, when an external device is used as a treatment, okay, when it is used as a treatment, like phototherapy. Phototherapy, it is a separate device, but it is treating a condition. So such procedures are coded under the section 7, extracorporeal or systemic therapies. Any doubts?
No.
Yes. Others, new joinees in the batch, any doubts? You can unmute yourself and you can just raise your queries. Yes?
Ma'am,
Yes?
once again, I wanted to know the difference between section 6 and 7.
Yes.
I mean, the section first digit 5 and 6.
Okay. See, when it is 6, okay? Sixth section is assistance and performance. What is performance or assistance? Any idea how a mechanical ventilation works? How? And your lungs has to breathe. It has to supply oxygen to your body. But who is doing that?
Machine.
Ventilator.
Yes, ventilator, a machine. So it is a function of your body which is done by an external device. Okay, but here, 7th section, it is a phototherapy. See, if a baby suffers jaundice, okay, jaundice, it has high bilirubin value. So the treatment is phototherapy. Phototherapy is done by the machine, but is it the baby's responsibility to do that? No. It is you are using an external device to treat a particular condition, which is not a part of your body functioning. Got it? Yes?
Okay, so that is for assistance, this is for treatment purpose.
Yes. So see, the name itself, section 7 indicates therapies. Extracorporeal or systemic therapies is the description of section 7. What is the description for section 6? Extracorporeal or systemic assistance and performance. Clear?
Yes.
So, when an external device is used to take up or do a physiological function, it comes under section 6. When the external device is used to give a treatment, it is given under section 7. Is it clear now?
Yes, ma'am.
Yes. Is it clear for everyone in the team?
Yes, ma'am.
Yes, ma'am.
Yes.
Yes,
Okay.
madam.
So now we will go for osteopathic treatment in inpatient coding. We are not using osteopathic codes. No experience in coding osteopathic section, but just to know any osteopathic treatments which is given. And in future, if we extend, see, nowadays we are coding only for hospitals which treat any critical conditions. Okay. So apart from that, we have a separate section in PCS, which is going to define this osteopathic treatment. So the root operation itself, it has the name. Just like physiotherapy. Any physiotherapist?
Yes, I am, madam.
Yes. So you have a lot of methodologies, right? Different names, which is not familiar to everyone. So such procedures in future, if we need a requirement to code physiotherapy coding also under PCS, so we will use this osteopathic section. Okay. So under this section, we have a set of root operations. So when we discuss the root operations, you can just have a look on it. Okay. Yes. And other procedures is a section where it cannot be included under any other sections. You cannot include it under medical and surgical. You cannot include it under extracorporeal systems. So such procedures like acupuncture or suture removal or IVF procedures, then we have a separate category called other procedures. Mostly reporting and procedure under other procedures are very rare, okay, very rare. And chiropractic section. So we have a separate treatment. Nowadays, it is even familiar in India also, right? Chiropractic treatment. What it is actually is your body has a flexibility. Your head, you can rotate or turn or tilt to some extent, okay? So they are going to manipulate the actual anatomical position to some extent, okay? So how far you can tilt your head, they will tilt it and they are going to give it as a therapy. See, for example, mostly in spinal compression or pain, they may even, they try to manipulate the actual position to some extent so that you get a relief for that pain. So that is the concept of this chiropractic treatment. But even just like osteopathic treatment, we are not coding. We are not using section 10 as of now. Okay, as of now, in major projects, 99% of the projects, this chiropractic is not used. Okay, so just know what is it. That's all. Then I will tell you one more thing. Until section 10, it comes under treatments. Okay, it comes under medical and surgical section. Okay, so these are some mandatory sections, right? Mandatory sections like any treatment given. From now, from 0 to 9, and from now it is starting from B. These are all called as ancillary section. Ancillary section is some support systems. See, for example, I will just show you the names quickly. Imaging, nuclear medicine, radiation therapy, mental health, and substance abuse treatment, new technologies. So these comes under ancillary section. Section 1 to 9 are medical and surgical related section, and B to D and F to H. These are called as ancillary sections. Okay. Why they are called as ancillary section? If you see, no, you can understand. See, B 11th section is for imaging. What are the types of imaging? Can anyone tell me examples for imaging?
CT scan,
Ultrasound,
MRI,
CT, MRI,
MRI. Yes.
MRI, ultrasound.
Yes, very
Fluoroscopy.
good. And one more thing, we are not coding a normal CT, MRI, ultrasound, and X-rays in inpatient coding. Okay, we will code only for specifically any major fluoroscopy assisted procedure. We give a fluoroscopy code, and MRI for major arteries like upper arteries or any. It varies from projects to projects. Okay, not all projects consider to want you to code imaging. And in common, I will tell you, CT, X-ray, ultrasound are not coded at all. Fluoroscopy and MRI, some of the projects, it varies. They want you to code additionally. And in that particular, we will focus on neurological cases. Okay, if you are coding a neurological procedure and that person underwent any upper artery MRI, and in such cases, we are reporting MRI separately, and that particularly it is responsible in which project you go. Okay, and fluoroscopy and ultrasound are coded separately when if a procedure is done and it uses a fluoroscopic guidance, for example, a left heart catheterization is done under fluoroscopy. So at that time, you have to code a fluoroscopy code separately. For example, in under PTCA, if it is used, and ultrasound, any procedure, if the any placement of a device, they are using an ultrasonography, at that time you can code. Or as general basic CT or ultrasound or X-rays, not coded. Clear? Yes. For major procedures, for guidance purpose, if it is done, then they would report it additionally, and a disclaimer, it depends upon the project into which you go. Okay, so now itself, don't stick like we have to code MRI with for guidance like that and all. It varies. You have to know, or it is completely a project specific guideline. Okay. And nuclear medicine, the same scenario. Till now, nuclear medicine coding we have not sticked it. Okay, it is not in common, but we have separate section for nuclear medicine if it is done for a treatment or even for diagnostic studies. We have separate route operations which is available for nuclear medicine. So the usage of radioactive isotopes, if it is and in many scans purpose, we have a separate coding available, and there are many route operations under nuclear medicine. So that we will see in detail. Then go for radiation therapy. Any radiation therapy, why we are going to use? For which conditions?
For
Chemotherapy.
cancer.
For cancer.
Yes, for the treatment of cancer. So generally, most of your projects will want you to give only an ICD code, that is encounter for radiation therapy. Apart from that, even PCS coding, broadly, we have not started to code PCS coding for radiation therapy. But we have availability. Do you know why PCS was developed? What is the reason? We had CPT before. Then what is the reason for other people to develop PCS?
For inpatients.
For
Okay, it is not particularly for inpatient. They wanted to form a procedural coding system which will include each and every procedure performed. And that particular code, okay, they have to develop a code series which is going to define everything. The nook and corner, the approach, the body part, the body system, whether what is the intensity, whether it is an open surgery or whether it is a percutaneous surgery. So everything they wanted to describe. So they wanted a code which is going to describe from a bypass procedure till even if any IV fluids is given, we are not coding an IP. But do we have a PCS code for IV fluids?
Yes.
Yes, we have. We are not following, but we have. So even for oral medications also we have PCS codes. So the whatever treatment or whatever procedure, whatever diagnostic studies which is adapted in medicine world, everything they wanted to have a coding. Everything they wanted to have a code. So that is why they have given a separate section for each and everything, and they have a lot many whatever new procedures are being developed in future also. And please unmute yourself if you are not talking to me kindly, because it is going to disturb your fellow mates. Okay? Yes. So for everything they can add how many ever, even see, from 20 years from now, if new technologies have been developed, they have space to add everything into this PCS. Okay, so now radiation therapy, nowadays, as I told you previously, nowadays we are not coding, but maybe in future we will. Okay. So then, physical rehabilitation and diagnostic cardiology, again, any speech language, and see nowadays these focused treatment are also not given, right? So, but they have an availability to give any physical rehabilitation procedures. Physical rehabilitation is a therapy which is given for them to lead a normal physical life. Okay, and then mental health we will use for mostly for electroconvulsive therapy. We will code in psychiatric coding, not in inpatient. In psych coding, generally counseling procedures, again it varies from your project. They may want you to report in PCS, or an ICD is enough in some projects. Apart from that, electroconvulsive therapy is a common treatment which is done for most of the psych patients, which we will code, that is periodically. The frequency is high. Other PCs are not generally performed. Okay, it is not even performed, so we are not coding it. And section H, that is substance abuse treatment. Any counseling given or for detoxification services. Generally, broadly, we will use this for a CIWA protocol. That is for alcohol-dependent patients. So when they undergo a detox service, then we have to assign this from H. What is the section?
Ma'am, do we not have E alphabet?
Yes, no. Yeah, maybe in future we may get, but as of now, no alphabet.
Okay, okay. Thank you.
Yes. So now then new technologies. We have a separate section called new technologies. Why? Because any technologies which they are going to introduce. Okay. See, for example, remdesivir. Okay, administration of remdesivir nowadays broadly each and every project they wanted to give an administration of remdesivir separately. Actually, in which section we can include remdesivir?
Administration.
Administration.
Very good, under administration, but they have added it under section X. Why? Because it is a new technology which is followed now. Okay, maybe after a revision they may add it under section 3. That we are not sure, but as of now it is present under section X. Okay. So, likewise, remdesivir is a very good example which I can tell you nowadays. But even periodically, whatever new technologies they found, most of the robotic assisted procedures are coded under section X. So you don't have to worry which section it has to come, because your 3M will lead. Your 3M is going to give you the code. So you don't have to worry about it. So we don't need how to judge whether it comes under which section. Mostly for this new technology procedures. For other procedures, you should have the ability to judge the section. Okay, for example, you told me now the remdesivir, it is going to come under administration section. Delivery, under which section we can give delivery?
Obstetrics.
Obstetrics. Very good. The patient underwent. The patient had an fracture and a splint was applied. Which section?
Placement.
Yes, very good. The patient had an chemotherapy.
Radiation.
Radiation.
Radiation therapy. Under
Chemotherapy.
radiation therapy.
Administration. Very good. And a patient underwent an MRI. Which section?
Imaging.
Very good. A patient underwent an CIWA protocol for alcohol detoxification.
Substance
Abuse
treatment.
Very good. A patient had an biopsy.
Pathology.
Zero section.
Medical
Yes.
and surgical
Surgical
section.
It's medical and
surgical
surgical section.
Very good. And a patient had electroconvulsive therapy for his major depressive disorder.
Monitoring.
Mental health.
Mental
Yes,
health.
this is mental health. Very good. A patient underwent an hemodialysis.
Administration.
Extracorporeal.
Yes. A baby underwent a phototherapy.
Extracorporeal therapy.
This is
Therapy.
therapies. Very good. So, are everyone in the batch, are you clear about the 17 sections, why it is used?
Yes.
Yes. Okay. So now we will move on little forward. These are the first characters. So the second characters are the body system, for which I think I don't have to explain in detail. Why? Because you all know, right, the basic body system. Musculoskeletal system, subcutaneous tissue, and respiratory system, digestive system. So similarly, we have the second section, second character. And the third character is a very, very important character. Why? Because you have to find out the third character. What is it? The third character?
Operation.
Root operation.
Root operation.
Root operation.
Yes, it is a root operation. So how are we going to judge the root operation? So why people you all would have heard, right? CPT, what you will do in CPT, all codes will be available. If you know to search a code in the book, it is more than enough. Agree? Yes.
Yes.
But in inpatient coding, to apply PCS, you have to know the knowledge of determining the root operation. Got it? You have to find out what is the root operation for this procedure. Okay, so that is where PCS coding, why we have to learn PCS coding separately is for the determination of root operation and for the approach. Only for these two values, because other values, just like CPT, you can just read the OP report and you can get the code. The tricky part is the root operation and the approach. Overall, under PCS, there are around 64 root operations. Okay, in whole PCS, like for the all 17 sections together, you have 64 root operations. Okay, and for the medical and
అప్పుడు వేడి కావాలి ఇప్పుడు చాలా సేపు అయింది
kindly
లోపల
go on.
ఇప్పుడు ఏంటి పెడుతున్నారా చేయనా
Yes.
Anita, you can mute that.
It is 64. 64. Okay. And there are 31 important root operations. 31 root operations in medical and surgical section. So that is the first 0 section. No, under 0, medical and surgical, we have 31 root operations. If you are going to attend an IP interview, you have to know the 31 root operations and the application of these 31 root operations on your fingertip. Okay. So this is a very, very major and a crucial part. And see that is this 31 root operation is the captain of the ship. Okay. Only if you know, only if you master these 31 root operations, you will clear the interview. That's all. And And in other way, the whole PCS comes under this 31 root operations. If you know to judge the 31 root operations, it is more than enough. You can master impatient coding. Got it? Yes.
Yes.
So apart from that, we have the fifth character, that is the approach. So approach we will see in your upcoming classes in detail. Okay. So apart from that, any doubts, new joinees from your side you have?
Once you can repeat that about root operation. Yes.
Like you want me to repeat about the root operations?
Yeah, that is confusing.
Okay, see, root operations, you will have a separate section. Separate session. Because each and every root operation, it will be explained in detail. So in the determination of root operation is a major part of your PCS coding. Okay, so as of now, just to know, I just wanted to give an introduction about PCS. Okay. So don't worry, you will have a separate session. It is not, I think all the 31 will not be covered under even one session. It will continue also. Okay. So, yes.
Will you share this PPT to us regularly or only the theory?
No, for, see, have you enrolled yourself?
Means?
Means
Yes.
your classroom application, everything, the access has been given to you?
No, nothing, not yet.
No.
Okay, so once you initiate a payment and if it is done, maybe within a week, a classroom application or you will be shared into some Google files, they will share it from our end. And in
Okay.
that, you will have a PDF form, okay? It will
All
not
the
be in a PPT, it is just a PDF. That's so that
Okay, we
for
can have all the we can have all the materials on our own.
yes, you can have all the materials. For older
Okay.
students, already you will have classroom application, you can access through it. And for the access, you have to directly contact sir.
Okay.
Ma'am, this live coding and coaching is the different or same?
Live coding is different where we will show you the 3M and we will give. Okay, we will code. First, you have to know the theory part, right?
Yes.
So once we have done with the theory part, then we will get into small scenarios. When I start root operation itself, small scenarios will be given to you, and after that, a complete chart like from ED document till discharge summary, we will discuss how you have to read, which part is very important, where you have to focus. So this is the way, now we are in a very basic stage.
Sorry for the interrupt. May I know your name, please?
Yes.
Yeah, about that regarding that is a CCSE exam. I want that information when we are going to write the CCSE exam. I tried to connect with Jagdish, but at that time he was very busy. He's unable to connect with me.
Okay, see, for the CCS examinations, if you clear if you complete your complete the ICT training with us and the PCS training, and you can take up the assessments, and a separate PCS question paper discussion session will also be handled by us. Okay, so you can clear PCS. CCS. And the thing
Ma'am.
is, yes. Wait, I will complete. And
Okay.
we have a lot of assessments in which will be shared to you. So once you clear CCS mock papers, okay. So mostly the same question pattern it will repeat, okay. And if you are lucky, you may even get the same question. So that we are not sure, because anything may happen during the exam. So for that, you have to first, if you clear all the assessments regarding CCS, whatever we are sharing, then you can get even about 350 out of 400. Yes, many of our students are getting above generally your pass mark you have to get about 300, 310. So generally our previous your seniors, no, they are getting about 330, 320. So no problem. And if you have to know about the exam fee, it will come around some 38,000 to 37,000, and including books. Books, it is for rental. So you have to take it for rental, and books will cost around 4,000 rupees. 4,000 is the maximum price which other vendors are giving. Because since it is an original book, each and every year the book copy will change. You have to carry the original book. So based upon your center, the nearby center, if you are going to take the book, and we will arrange centers and books also for you. Okay, so if you spend around some 40,000, then that is our overall cost for your CCS examination, like including the books cost also. Any other
ma'am.
particular information you want to know about CCS?
Yes, ma'am.
Yes, another. The person who asked me the doubt, first I will complete, okay? Okay, now, yeah, you can ask your doubt, yeah.
I have already certified with CPC.
Okay.
Because of the professional growth, I wanted to write a CCS so that I can get into the IPDRG completely. Because some projects, the particular needs for CIC and CCS to get into the project.
Yes, because CPC,
Yeah,
they don't prefer an inpatient. Yes.
Yeah, that's what I wanted to do at CCS, because I heard that CIC is more difficult to clear compared with the CCS.
Yes.
So when I spoke with the sir, no, he's told to take up both the CCS and IPDRG combo class.
Yes.
So that will be covered in this session, no?
This session, it is for
No, I mean
IPDRG.
this course, in this course.
Yes. Course,
Actually,
yes.
I was planning for December end to give the exam, but
Okay.
he told to give it out by Jan mid, so that you will know something much better than before December end. But as per the schedule, 80 days schedule, can I really attend the exam by Jan mid, because it is 80 days course. But what he suggested me to write by Jan mid.
See, it depends upon your individual capacity, because I can't give you an assurance. CCS, some 40% comes with CPT. Since you are a CPC certified candidate, he will suggest you to take it in January mid. Why? Because CCS split up, it is not only with PCS. Okay. For CCS, and you are already coding in coding, right?
Yes.
Which in ED or what?
No. I was having experience only in HCC.
HCC.
So
Okay.
I have completed my CPC in 2017.
Okay. So
totally,
ICD classes got over for you, no, right?
I don't know, because he told the new batch is starting from today.
Okay, no problem. No problem then. So once we complete PCS, you have to take up all the PCS assessments then and there. Okay. So when you take up your assessments, yes.
CPT also I need help, because CPT I didn't even touch after my examination.
No problem. See, can I tell you one more information? most
Yes,
of
please.
our inpatient coders, most of the new joinees under inpatient, they
Okay.
take up CCS by preparing CPT only for 2 to 3 days.
Okay.
Because as you know, CPT is only searching in the book.
Yes, very easy. It was very easy.
Yes. So,
Yeah.
we will give you a brush up, like what is a basic, where to find out the modifier description, where to find out this. Just a 2 to 3 days class of brush up. People
Okay.
who are new to CPT-HF, they are very much familiar. So since you have cleared CPC, it will be very, very familiar for you.
Okay.
And
Okay.
regarding PCS and ICD, in January mid, I think all of your PCS ICD portions will be completed. Okay.
Okay. I have only one more doubt. He said that this IPDRG CCS classes will be starting from today, but
Yes.
actually we are in the 30th column, no? Intro PCS. Before that, many classes, 29 sessions has been over already.
30th column, I can't get you.
He sent a schedule sheet, Excel sheet.
Maybe that is for ICD, I think. Yes.
So 29 sessions has been already over.
No. Wait, my question is, the 29th session schedule do you have?
No, today is my first class.
No. You saw in a PDF, right?
No. He has sent some Texas schedule copy in that Texas group. As per that schedule, we are in the 30th column. So previously around.
No problem. See, maybe ICD classes would have been got over. Okay.
Yes.
So for this batch, if PCS once it is done, again we will start a new batch with ICD.
Okay.
Along with you, some other ICD new people will also join. So ICD and PCS has no relation. So if we are starting PCS, then we will have even new joinees to the whole batch. Okay. And ICD separately. So don't worry. For PCS, today is the first class. Once PCS is done, then we will start an ICD batch. In that batch, you can join for ICD.
Okay. So in between the CPD also will be done. In between CPD also will be done.
That schedule you have to go and ask to your HR. Okay, because I am a trainer. Because if any batches, if it is allocated to me, then I will handle.
Okay.
Okay, so as of now, what information which I got is today a PCS new batch is starting for IP and PCS and CCS, CIC, everything. Today is the common batch.
Okay. Thank you.
Yes. And Mohammed, you if you need any personal like some a specific training, you have to ask sir. Okay, sir or the particular HR, because I don't know. We take batches in common. Or if you want to take, basics very well, then you can join directly the CCS classes alone. I will suggest you to take up all the assessments, and if you clear the assessments, and they will allocate some other. You can, or else you can directly join. You can directly join CCS training course alone. Live classes alone you can join. But separate batch, if it is available, you have to ask sir or your HR. Okay, I don't know about it. You have
May I
done
know
CCS.
HR name?
HR, there are different HRs, you can contact them. Okay.
Hello, ma'am.
Do you have?
No, I don't share them in particular. You can directly ask sir regarding them. Okay.
Okay.
Yes.
Hello, ma'am.
Yes.
I joined the institute in September, and I completed ICD classes, and I
Okay.
completed PCS classes already.
Okay.
Last month also I completed. Now I
Okay.
want to write the CIC examination this month.
Okay. Okay.
Still my exam preparation is not started. I didn't get. I'm continuously attending these classes only.
Again, I will tell you that I am not responsible for your
No,
schedule.
I'm asking what is my next step for a CIC examination. Did
CIC, have you enrolled for CIC?
I said my HR about I want to write CIC examination, and he said
Oh,
you need to book some slot.
actually, live classes went last week or before that, I guess. Just give me 1 second.
Yeah, I attended that live classes also.
Yes, your live classes also completed. So, have you completed all the assessments regarding CIC?
I did so many assessments about a route operation like that in that classroom application.
Okay. So your next, if you see CIC practice assessments, there are many
No,
assessments.
I didn't
Practice
done anything related to CIC. I only did a route operation assessment. It's a section assessment like that in that classroom application.
Okay, whether CIC question assessments is not posted for you, then you can request sir directly.
So my next step is I need to ask him, right?
Yes, yes, yes.
Then all when I asked him, he said you need to book some slot. After that only he can start their exam preparation. But I'm not that much confident. After booking slot, I don't know I can crack that. So
Okay.
first I need training, then only I can book that slot. That's why I'm full of doubt actually.
Okay. So I think they will plan live classes, so not live classes, question paper discussion classes. So you can just contact sir regarding it. Okay, for your further uh,
Okay,
further step.
I'm texting him, but he said next week it will start. I almost
Okay.
completed 2 months. That's why I feel confused. That's why every link I will join.
Okay,
Okay.
so I think you have to ask sir, because I don't know, because other people they are writing. Once you complete assessments, it's if they are writing. So I don't know what happened with you in person. So you can
Okay.
just ask him, just have a word with him.
Okay. Thanks a lot.
Yeah. And see, PPT is required. Everything you have to ask directly to sir, because PPT sharing I cannot do. Okay, I cannot do. If you are taking any screenshot in your mobile phones, then it is up to you. But I don't have to join. I don't have access to share. Okay. So okay team, so we will wind up for today, and tomorrow's class, it will be posted in the group. Okay. Yeah. Thank you.
Thank you.
Yeah. Your name and please,
Yeah, my name is Swarna.
Swarna.
Yes. And CPC certified candidates, you will get a job, but among 10 companies, only 2 companies, 2 projects offer you offer IP coding for CPC candidates. Okay, you have opportunities, but it is very, very, very less.
Is it really which is comparatively easy, CAC or CCS?
CCS, go for CCS.
Yes. Yeah, but there will be, I have to do 2 membership, no, for since I have completed already my CP.
Yes, you should have 2 membership, but still, if you are new to inpatient, I will not suggest you CIC.
Yes, I'm very new to CAC, sorry, inpatient.
So better go for CCS. Just ignore your previous cert. Like for membership, if you have to do, at least minimum you should have some experience in IP, or else you should have the confidence in taking up a lot of assessments, and you have to master inpatient. Why? Because CCS there will be options. There will be options you can select, but CIC no options. You have to be confident in each and every code which you assign, which will not come without practice.
Okay.
So personally, I will not suggest you CIC.
Okay. Thank you. Thank you so
Because
much, ma'am.
yes, we all wanted to get a job immediately, right? Maybe
Yes.
like January end, you have to clear CCS. So for that, CCS is only the best option.
Okay. Okay. Thank you so much.
Okay. Okay, team. So then we will wind up for today and we can join tomorrow. Okay. Bye bye.
Okay. Good night. Bye.
Yeah. Good night.
Thank you, ma'am.
Yeah. Thank you.
Thanks, ma'am.
Yeah. Thank
Thank
you.
you.
Bye bye.